Call the joint agency meeting to order. Welcome everyone who is here. I would ask that you'd go around and introduce yourself and whom you represent, please, because there's some new faces.
Starting here?
Sure.
Susan Mims, Iowa City Council.
John Lundell, the mayor of Coralville.
Rod Sullivan, Board of Supervisors.
Laura Burgess, Iowa City Council.
Janice Weiner, Iowa City Council.
Lisa Williams, School Board Member.
Bruce Teague, Mayor of Iowa City.
Charlie Eastham, member of the school board.
Terry Donahue, Mayor of North Liberty.
Iowa City Council, Pauline Taylor.
Janelle Reddick, Board of Supervisors.
Janet Godwin, School District.
Brent Smith, North Liberty City Council.
Megan Foster, Coralville City Council.
Kathy Knievel, Hill City Council.
Tim Kemp, Mayor Hills.
Louise Fromm, Mayor, University Heights.
Roy Sam Porter, Johnson County Supervisors.
Lisa Green Douglas, Board of Supervisors.
And do we have any elected or officials in the audience that couldn't find a seat up here yet? If not, we'll move on ahead. Update, Johnson County Access Center. All yours, sir.
Thank you. Good afternoon, everybody. Matt Miller, Project Manager for Johnson County on this. I realize some of you are probably more in the know on this project than others, so I've kind of kept this at a high level, but if you have any questions as I'm going through, please just stop me. That's not going to slow me down by any means. So first thing, I've got the project kind of broken into 5 different phases. So we've got building, operational legal structure, funding, community outreach, and operations. I'll go through each one of those. Starting with the building. So our building permit was issued on November 22nd. Construction started shortly thereafter. We were pretty fortunate to have a pretty mild December, so work got to continue. Work got started on the building pad. They put in trench footings, did some rock and some grading, things like that. They started the plumbing last week. This is any plumbing that's going in below 42 inches deep. I did just talk with their construction project manager today, though, and winter shutdown is going to occur at the end of this week. It's just going to be too cold to do any of the remaining activities. They still have roughly 1/3 of the trench footings to pour. He said they need like 2 to 3 days for that. There's some utilities grading that they have to do, and they need to re-pour some of the curb cuts as well. So it's just a lot of the concrete stuff that you can't do when the temperatures get this low. Basically, we had planned for a winter shutdown anyway, but the activities we wanted to get done before the winter shutdown are not complete yet. Now, I don't know exactly what that means yet quite at this time because it may warm up again and they may be able to finish some of this work as well. So it's really contingent on the weather at this point. What they talked to me on the phone today about was that they'll put together an official change order request and let me know what they think the timeline implications could be or what the cost implications could be. So I'm still gathering information on that, but that's where we currently sit with everything. And for those of you, once again, who haven't seen it, I've got a building plan here. If anybody has questions, I can walk through anything. If not, I'll just move on. Okay, next up, we've been working on operational and legal structure. So the managing entity and service provider agreements are underway. Sorry for how small this is, but you can kind of see what our structure looks like there. So we've got most of that worked out. We're still just working on adding some final detail. The 2 key pieces that we're working on are financial reporting requirements. So Abbey Health, you can see there is the managing entity. They have provided some sample reports of what they'll normally show. So now the county and our county counterparts who are partners on this are going through and determining if that's what we want or if we need some more specific requirements. Same thing with the evaluation metrics here as well. All of our current service providers are required to provide a certain level of reporting just by the state Chapter 24 requirements. What we're doing is going through and determining what additional things we want to do above and beyond that, like what would be in our reporting that we could provide to law enforcement and everyone else. So we're kind of standardizing what we want there. But once again, it's just adding the detail to the contracts to make sure that we're not missing anything. Next up, funding. This has been taking all my time in the last 2 weeks, I'll be honest with you, as I'm sure it's taking all you guys' time as well. So really what we're doing, this being budget season, is working on making sure we have very accurate budget estimates at this time. Just to save you the suspense, where we're currently at with capital funding would be $10.3 million for capital. That's all in, that's construction of the building, that's marketing costs, other things like that. With operations, we're looking at within our first year, we're needing $1.2 million in funding for that. So we're definitely working on a few different things there. So the East Central region is the mental health disability services region that we fall into. We presented to them last week with what our operational budget was going to be and walked through some of those numbers and estimates. I'm going to their board meeting next week as well to talk that through with them. So we're trying to work closely with them to make sure that the mental health side of this is going to be funded. The other thing that is relevant to all you guys is the 2080 agreement. I know that the 3 municipalities went in together and provided one agreement back to the county. We've taken a look at that, and I think you'll be hearing from us pretty shortly on that. One thing I'll encourage is for city council members, please make sure you're working with your attorney and getting this on agendas and pushing it forward. I think I was here at your October 14th meeting and kind of said the same message, and at the time, I hoped we'd have it wrapped up by Thanksgiving. Here we are in the new year and we're still not done. So once again, I'll mention, just please make sure you're having communication with your or with your attorneys about that. The other thing I'll mention that we're working on here is meeting with payers. Through some of our connections with the university, we've been able to get some meetings with Medicaid organizations, and we have an upcoming meeting with Wellmark here just to talk about reimbursement rates. We know that access centers are sort of in a different middle ground. We're not necessarily inpatient, we're not necessarily outpatient, we're just kind of a new program. So we're talking about what different reimbursement packages we might be able to get, things of that nature, just making sure that we're getting the optimum amount of funding that we can to make sure we're sustainable long term. We also met with Liz Matney, who is the governor's health policy advisor. We met with her about a month ago in Des Moines. So a lot of positive meetings have been going on, and we'll try to keep those going as well. But obviously funding right now is the big issue. If you can read my graph, which is a little small, one thing I love about this is it actually shows how much participation there is in this. It's great that we have all the municipalities providing support. It's great that we're working with the region and what Johnson County's done. I think we're pretty unique in the fact that this is being funded from a lot of different sources, whereas other access centers you look at throughout the country or even other ones more locally, they're really leaning on just like one payer source. So we're trying to do everything we can to work with a lot of people here and diversify that way. Any questions thus far? Okay. So here's an exciting piece. So for community outreach, we have been working with Meld Marketing to help us with our name, logo, and brand identity. You can see our name and logo down there, which hopefully will be approved by the Board of Supervisors. That's on our work agenda for next week. But internally, with some of our executive committee members, they've all reviewed this and given this their blessing. So we're going to be rolling this out officially as the GuideLink Center. You can see our tagline and logo there as well. Meld has also been working with us on website development. We've purchased a domain name, and they're working on getting the site set up. We also have several print materials that'll be available as well. We'll have some different brochures that are targeted at different audiences, whether it's just the general public or whether it's healthcare providers or whether it's law enforcement. So we're going through that, and we'll have like a quick reference card we'll be able to hand out too. So we really are working to get this kind of finalized and then start getting the word about this more and more as we get closer to opening. And that's kind of a cool sign. That's not going to be our sign or our building, but that's just kind of an example of what it looks like. I find it helps people visualize it and kind of get behind it a little bit more. So GuideLink Center is what you'll be seeing in the near future when referring to Access Center. The final thing I want to mention is from an operational standpoint, what we're doing. Some of this stuff kind of overlaps with other areas, but a few things I'll mention here is a medical director. So Abbey Health, as our managing entity, will be hiring a medical director, and they've already got someone selected in mind for this. This is someone who's dual trained in both family medicine and psychiatry. Came with a really strong recommendation, actually did her med school here at the U of I, and then has been out in Denver for the last few years kind of running a similar type of clinic. So we're really excited to have her starting. She'll be back as an MD at UIHC on January 31st, and then contracting to start working with us this summer, hopefully. So it's good to get her on the ground floor here. Working on staffing optimization here as well. So a lot of our service providers have been looking to figure out staffing ratios. Boy, that is a sensitive chord, whoever told me that. It's okay, we're basically at the end. So staffing optimization is what they're going to be looking at. basically looking at our different ratios. We had a call with kind of that peer institution in San Antonio last week to take a look at what they're doing. So we're really trying to work through that. We've also working on our workflows. Like when someone shows up at the center, how is that workflow actually going to go? Who's going to be taking care of who's doing what? So we just want to make sure we have that all mapped out and clarified. So we've been meeting to discuss that. And the final thing, I mentioned this a little bit early, but performance metrics, that overlaps with what we want to get in our contracts, but here as well, because it's going to be how we evaluate if we're successful or not. So we're taking a look at all of those options there. Had a really good call this morning with someone who has set up an access center in Arizona. Connections AZ is the name of that one. Really positive call with them this morning. So we're learning from what others have done as well throughout the country. And so those would be the 5 project phases. Are there any other questions you guys may have for me?
Questions or comments? John?
Well, first a comment and then a question. Our intent in Coralville is to review the 2080 agreement at tomorrow night's work session with the hope of getting it to a point where we will approve it at our last meeting in January, the 4th Tuesday. So that's our goal, is to get it done by the end of the month. And my question is, you mentioned the Essential group that you have talked to and are going to go meet with.
Yes.
Did I read in the paper, did they preliminarily reject you, or was that some other group that I'm confusing?
They did, but we weren't even there to be rejected. I'll say
Oh,
that. So
okay.
I think it came up at their last meeting. I wasn't notified that they were even going to be talking about our access center. I think Lynn County talked about theirs, and it kind of got roundly put off for later. I had been in contact with their CEO actually just before that meeting, and she told me about a big strategy session that they have coming up in February, and she told me that's the thing to be prepared for. So I wasn't even honestly aware that Lynn County was going to be bringing that up, and then when I saw it in the paper, I'm like, okay, that kind of got blown up a little
Okay,
bit.
that's the
So,
same thing.
man.
They did end up inviting me for January, and
Okay.
then we'll talk about the February strategy session too. So that was the agenda that I always thought got laid out.
Thanks.
Just to that, I was at that meeting, and it ended up being almost more of a timing issue, because Lynn County was looking to sign a contract for some of the construction that they're having done, and that was coming up right away, and they wanted a firm commitment on the numbers, and our budget person was not at that meeting, was not able to be there, and so without the firm numbers, the board chose to not say absolutely yes, but kind of like conceptually, we're okay with it, but we need to see numbers. And so that's coming up next week, the 23rd, and if anybody wants to just show up as a show of support, that would be wonderful. 1:30 in Lynn County, Gene Oxley Building, on the 23rd.
Any other questions?
Where can I get more information about this? I mean, maybe even your,
I'm glad to send you some information. Sorry, I have my contact information in the presentation, which is not showing. Let me just leave some
Matt can
information
come
for
to
you.
a city council meeting.
Yeah, or I'd be glad to do that, certainly.
I know, but I want to, make a report first and
Yeah.
get more information.
Let me leave you my contact
Okay.
information. I actually have a card out in my car, so I'll bring it in for you.
Thank you.
Yes, you had a comment.
Matt, I'm sure I should know this, but is it expected that either clients seeking services at the Access Center or adults, or not adults, but minors who may be seeking services, is it expected that there will be students in the local school system that would be involved with people who are seeking access or seeking services?
So we'll be 18 and older, so adult-only facility.
Okay.
We do plan on probably getting quite a bit of university students will be there. I'm not sure if I understand your question.
Well,
about, like, will any students be working with?
Not necessarily working, but would any students be family members of clients who are coming to the Access Center?
Would students be family members of people that
K
can show up at the
through
Access
12,
Center?
K through 12 age students.
It's certainly possible that, if adults could be there that would have children in school, if I'm
And
understanding.
have we, in terms of the management structure and the operational structure, have we thought through how that would work with what the school district would likely be interested in terms of what services their
Like the parents are receiving?
parents might receive and how that affects.
I personally haven't been a part of any of those discussions, but I'll say that if those are current things that are happening, like at Prelude or with with Abbey Community Mental Health, I mean, I'm sure those will continue. I'm not sure what they do currently, but I can certainly jot that down and check in with them to see what kind of considerations we need to be making there.
Okay, and I may be amiss here. The district may be well aware of what the possibilities are and how to accommodate them.
Sure. I mean, I'm not even at first thought. My first thought is how would that even work with like HIPAA regulations and things like that? Like, can you notify a school district if someone? So basically, like, if I'm understanding correctly, like, for example, you're saying somebody could be a 7th grade student at somewhere, and their parent could show up because they're having a mental health crisis, and they could be in our crisis obs unit, and maybe we find out that they have a substance abuse problem as well, and they go through detox with us. Are you saying, like, would we notify the school district that that parent is going through that?
I'm not quite sure what I'm saying, but but if there are school-age kids involved with people coming to the Access Center,
Well, there certainly won't be any school-age kids directly getting
I
services
understand
put
that.
up from us, but yeah, if their parents, I'm not really sure. to
So
be honest.
Charlie, we're working pretty closely with some folks who do emergency medicine at UIHC.
okay.
And I'm sure that they run into that all the time and probably have some procedures, and the odds are good that we'll want to borrow whatever procedures they have
Yeah.
and do something similar.
Yeah, certainly. I'll touch base with our service providers because this really is a continuation of services that are already available. We're just putting them all under one roof. So I'll definitely bring that up at our next service provider meeting, and maybe they can fill me in on what's going on there.
Okay, thank you.
Charlie, kind of separate, but may help a little bit. Separately, the county pays for a program that's emergency childcare. So law enforcement knows that through 4Cs, and if a parent, for example, is taken to the emergency room or detained, and there are no other options, family that can be called and whatnot, the county pays through block grants for emergency childcare, but that doesn't answer your question about whether or not then the school can be communicated with about that.
Right, and that's true.
But,
Yeah.
I would assume that program will be important as parents who may have no other resources already do become involved in this broader system. So that is a temporary fix, but not a long-term fix.
Okay, thank you.
Any other comments or questions? Matt, thank you.
Thank you, guys. Appreciate the time.
Proposed 2880 agreement for the Johnson County Access Center. And who is giving us information on that?
Well, this is essentially, Matt touched on this, but for the cities of Iowa City, Coralville, and North Liberty, along with the county, each of us has attorneys working on this. I see ours out in the audience. And we are getting close to getting some agreements that will have to be voted on by each entity and approved. And so, as Matt was saying, we've been working on this for a while. We just don't want to let it linger too much longer, in part because with construction having already started, we're already paying bills, and we would like some more money with which to pay them. But I'm told by the attorneys that they're really down to just a couple of sticking points, and so hopefully, I believe the ball is in our court right now, but there'll be something coming out to the rest of you shortly, and we just want to get this done as soon as we can. So just a reminder to keep it on your front burners.
Thank you. Go ahead.
Is there a date that the Johnson County Board of Supervisors is aiming for?
I don't think there's a set date. We just want to get it done sooner rather than later.
We'll need the money soon.
Yeah.
I guess he tried for Thanksgiving and we didn't get there. And so,
Because you all are working through your budget now.
Yeah.
I mean, certainly once it gets warm enough again to do construction, we will burn through what we have available, and we'll want to get into some other sources of income, yeah. So.
It might actually be a good idea if you're willing, as you have your agendas, looking out here at the people who do those, to have a standing item on your agenda so that if something comes up, you do have the ability to discuss it because, when Matt mentioned that weather is going to be part of our guiding force in terms of when we can do things, and then that would also dictate when we need the money. If you have a standing agenda item, then you can bring it up at any meeting that you have. And that might be an option. I would really encourage you to consider that, both for the monetary commitment, but also for the 2080 agreements as they are finished.
Anything else on that one? Thank you, one and all. Johnson County Mobile Home Task Force report.
Thank you. Most of you should have gotten the copies of the report, which was in the back of the room. If you didn't, I think there's still some more back there because it's very helpful because it's very lengthy. I'll go through each and every page if you'd like, but that might be a little tedious, so it'd be best, I think, if you can take it along with you and kind of absorb the things. And I'll touch on a few of the things that I'd like you to really focus on. The Johnson County Mobile Home Task Force was convened last spring in conjunction with Sarah Behrens, and I think most of you know Sarah. I'd like to recognize her there because she was very instrumental in this, and the Johnson County, along with the Johnson County Affordable Homes Coalition, to identify what could be done to protect residents of mobile home communities. And this was done in reaction to what most of you are probably aware was going on at that time, and that was the unexpected crisis of predatory investors purchasing existing mobile home parks in the area. Gulfview in North Liberty for one, Sunrise in the eastern side of Iowa City, Western Hills in Coralville, and one in West Branch. And first, I want to say that this report was not solely an Iowa City accomplishment, but was a joint effort by many entities, some of whom are sitting up here at the table along with us and some out in the audience. It was one of the most remarkable groups of people that I've ever been a part of. You can see from the list of members that's on the second page there that there were representatives from just about every entity you could think of, which was really great. It was especially great to have State Senator Zach Walz as part of our group. The report, as you can go through it, can see has a set of 12 recommendations that we hope can be considered and adopted by local city and county governments, as well as what can be done at the state level. Senator Walz has assured us that he has been and will continue to advocate on the state level for the rights of mobile home residents, especially in regards to rent protection, and good cause eviction language. It was shocking to learn that there's very little on the state level that protects these individuals from these kinds of things. It's become critically important to preserve the affordability and quality of living that these mobile home communities provide. For many years, they have been a level of affordable living that had been unmet by any other markets. This has been threatened by those private investors. Immediately after their purchase of Gulfview, as many of you might be aware, they announced a 63% increase in the rent, which I don't know about you, but if my budget was increased that much, I don't know where I would cut corners. That's just phenomenal and deplorable, I would say. I would like to give credit also to the University of Iowa Law Clinic students. They compiled some great data for this report. You can see it in here, the numbers and data, most notably rent rates. The 3 highest lot rents in Johnson County are all parks that were owned by these investment firms, which that makes a statement right there. And the park values, their land values, have seen significant increase. One of them jumping from $1 million in 2012 to over $10 million in 2019. That's quite a significant increase. In developing the recommendations, our group looked at other states and what they have done to offer protection for mobile home residents and to ascertain that manufactured housing continues to be a source of affordable housing. We found that these predators have become a nationwide trend, and cities across the country are seeking ways to preserve the affordable aspect of mobile home communities. Thank you to those of you, I think some of you, maybe North Liberty and perhaps Coralville, have brought this to the attention of your governing bodies already. The Iowa City Council shared the report with our city staff, and I'm pleased to say that in our most recent 2021 to 2025 City Steps 5-year plan for housing, jobs, and services for low-income residents has language that now reflects that mobile home or modular homes are an important part of the affordable housing market. And one important item is the need to expand rehab efforts for a number of these mobile homes. Recommendation number 8 is one that I'd like you to pay attention to. It relates to a joint collaboration statement. What I would ask is that we as a group consider making such a joint statement. Some of you might need more time to kind of digest all of this information and perhaps take it back to your joint governing bodies for their thoughts on this. But I would like to stress the importance of these recommendations to enable mobile home communities to continue to be safe, stable, and affordable housing options because as the report states and everybody says is that everyone deserves to be housing secure. Sarah, do you have anything you can add to that?
Hi, Sarah Barron. I'm the director of the Affordable Housing Coalition. I just want to highlight that this was a report specifically focused on what our local governments can do in response to the crisis facing manufactured housing communities. So there are many, many things happening. The scope of this report is really on what you all can do. And admittedly, it's limited. It's limited based on state law, it's limited based on resources, and that's why we really wanted to find what were the action steps you could take. And so each of these 12 recommendations has been vetted by our task force members. Some of them might be a little bolder in what it asks for from you than others, but each of them represents a critical piece of putting the whole puzzle together to provide ongoing security for residents in manufactured housing. We're talking about 3,000 households in Johnson County who rely on manufactured housing for affordable options. People who do not have access to other housing at that price point that meets their needs in the same way. Some of our most economically vulnerable residents, lots of folks on fixed incomes, lots of folks who are working important entry-level jobs in our community, people with children, retired people living on Social Security. And so it's critically important that they have a housing opportunity in the community that's supported and that's stable. And I can also share with you that alongside the work you all are doing in response to these recommendations are a number of other actions taking place on the state and national level as well as locally to keep strengthening resources. Some of you may have seen that Representative Cindy Axney recently introduced some legislation to protect manufactured housing residents. We will see some bills certainly in the Iowa legislature this coming session. And also our social services providers and residents are working together to strengthen resources on that level as well. So this is just kind of your piece of the pie to help us take care of. So thank you.
Any questions for either presenter? Oh, okay.
Terry, if you don't mind.
Yeah, go ahead.
Sarah, you mentioned children living in mobile home parks. Do we have any idea about how many school-age children might be living among those 3,000 plus households in the county?
I don't have any data about that. And one of the recommendations, frankly, talks a little bit about being more explicit about manufactured housing communities and who lives in them. Even in our existing data, it's difficult to tease out, in many cases, who lives in manufactured housing because it straddles ownership and rental in some ways. Lots of folks own their home, but they rent the land that their home sits on. Sometimes it's difficult to identify them in the numbers that exist. I do think I could get that data, though, because Len Sandler, professor with the University of Iowa College of Law, has been absolutely dogged in getting together all of the data that one could possibly muster about manufactured housing communities. And so I could probably get that information. You have it, Steve?
We have 1,179 students in our district. So that's not the whole county, just in the Iowa City community.
What'd you say?
What was your
3,000.
source for that?
We pulled them by address.
Wow, that's a-
and used the actual mobile home coordinator.
There you go.
Well, thank you very much, Steve.
I'd also like to add a kudos to I mentioned Gulfview. Those residents banded together, and as an organized labor member, we've always talked about Stronger Together. And these folks banded together and formed an association. And that 63% rent increase, it's still going to happen, but the new owners, and you can correct me on this if I'm wrong, agreed to stagger it over time rather than just one lump. All of a sudden, it's going to be 63% increase. So we're trying also to encourage some of the other mobile home parks to form associations because it's very helpful.
So you folks have what, like 13 or 14,000 students, Steve? Is that 14.5? So that's
good.
7 or 8% or something like that. That's
Good percent.
So,
hard
Sarah,
to guess.
the way they did it by using address should be possible at Clear Creek and Manna also, which there are several large mobile home parks in that district.
Western Hills. Western Hills and Parkview.
We could ask the district to find
Yeah. It'd be interesting to see both major districts.
Anything else on the subject?
Can I add one more thing?
Sure.
Sorry. So my job as the person who convened this committee, I think it's my duty to make sure that this report doesn't go on your shelves to collect dust. So I will ask you, what have you been doing? And, Pauline did a great job of pointing out that they already reflected on their existing documents and how they could be more specific about what programs are available to folks who live in mobile homes. You should feel free to brag every time you accomplish one of the things on that list of 12. And I'm going to particularly urge you to really think about the funding that's available, both for helping residents who have been harmed by dramatic and traumatic rent increases, but also to preserve the stability of these manufactured homes. Because if we don't invest in keeping these homes in good quality, I can't, in all good consciousness, call it a great stable place for someone to live either. So it's not just about them having an address, it's about them having a home that contributes to a sense of stability and well-being. And for many of these homes, there's some work that needs to happen. One of the things we looked at was, okay, if I'm someone who has a hole in my floor, do any of these recommendations help me? And unfortunately, that's a question we have to ask on behalf of many of our manufactured housing residents. So thank you for looking at it, and go back and say, what's our plan for addressing these items? And thank you.
I'm sorry, Sarah, one more question before you leave. Of the 3,000 units, what number is pre-1976?
I think that there's a good amount of that data in one of the report things, but it kind of you have to go through and count each one, and so sometimes you have to tease that a little bit
And
too.
for those that don't
Len
know.
got a spreadsheet for every county, every housing type, how many were constructed in each of the windows of time. And so I can zero in on that data if it's not in there already.
Mobile homes that are pre-1976 are dangerous.
They weren't built to the same standards that we would want to see for a stick-built house. And so, down the road, we need to have more conversations about how to help residents to replace those homes or other things as well. So this is an ongoing conversation in some ways.
Thanks.
Thank you, Sarah.
Anything else on the subject? Okay, general entity updates, and I'll do this on a volunteer basis before I start calling on people.
Well, I'll go
Thank
first.
you. You were going to be first on the list.
I just have an invitation to all of you to hand out. you all know that we're building a new arena in Coralville that'll be opening in August. And about every 6 weeks or so, we try and have a community open house just to give the latest updates on where things stand and show off the latest photos and plans and so forth. And the ones we've had so far have all been somewhere in a different business down in the river landing area near the arena. But we really, really, really believe this is a regional facility and will benefit the entire community and everyone represented here. So we're going to start moving these community meetings around, and the next one is this Thursday, just 3 days from now, at the View Restaurant in downtown Iowa City at 4:30. So if you'd like to get an update and do it in a beautiful surrounding, the View this Thursday at 4:30, you can hear some more about it. So, thank you.
Others?
For Iowa City, our climate action emergency, the plan there for the 100 days that we have executed through our staff will be, we have actually created a climate action commission, and so they have the 100-day report that we'll be eager to receive back on the council agenda just to make some final decisions there. So I would just urge everybody to keep their ear out for that. I know that the school board has done something along the line of climate action, as well as the university, as well, University of Iowa. So as Iowa City unveils some more of what we're doing, just wanted to make sure that you all are aware and keep an eye out.
May I piggyback? From the school board standpoint, we have our baseline emissions data that we worked with the University of Northern Iowa to collect. We had the preliminary report before the holidays. Tomorrow at our board meeting, we'll be going through a plan that's been put forward based on that baseline emissions information. And so I think we'll have a good conversation at the board meeting tomorrow night and what our plan is looking like for the school district. And I think it's looking good. I think we'll hit the 45% reduction according to our forecast by 2022 instead of 2030. So I think we're making good progress. A lot of things that we'll be talking about in terms of initiatives going forward to bring those emissions down to the 2050 goal of zero. And one more thing while I'm giving an update from the school board, we're also doing some work around mission and vision for our district. You've heard a number of our directors talk about that, and we'll be talking about that in a work session tomorrow. Working with a group called Battelle, a community coming in to work in our community to help us as a community understand what we want the role of the school district to be in terms of our secondary, community college, business community, what can our schools be doing to help our entire region. So we'll be going through a discussion at our work session tomorrow to talk about what that process looks like and help folks understand what their role can be in that kind of mission vision work as we talk about a portrait of a graduate. So anything else, Charlie or Lisa, that you'd want to add?
It's fine, thanks.
Thank you.
I want to say, my wife and I attended Choirs for a Cause last week. That place was packed, and it was nice to see all 3 high schools participate in a fantastic program. And please pass that on to your, arts and music teachers, because it was almost overwhelming.
Yeah, will do. Thank you.
Any other volunteers?
I guess from a county perspective, you heard a lot of what we've been spending time on, which was the Access Center discussion. Probably like the rest of you, a lot of work on budget. And I would say that would primarily be any report I would give. Anybody have anything else they think of?
Okay. As far as North Liberty is concerned, Police Department building is on schedule, and we're hoping for an April move-in date. And this is even after we found 2 cisterns and an empty old gas tank in the ground. This is really fun for our people to tackle, but it looks like April is a very real possibility. St. Andrews Drive, that goes from Community Park to North Bend School, we will be taking bids on that and working at this year, so that road would be completely complete. The Southwest Growth Area, that is going to go out for bid in the very near future, and this is a major sewer project that we've been working on that will go on either side of the interstate. And once that's done, it's going to open approximately 500 acres around the interstate for development. So we're taking on that beast as well. Anything else from anyone?
Mayor, I'd like to invite everyone to our Beat the Bitter festivals. A lot of hibernation happens in the wintertime, and we don't all have community festivals, but our Beat the Bitter will be January 25th through February 1st with lots of family fun activities, all free. Those that are paid are sold out, from what I've been told, so we hope to see everyone and welcome everybody to join us in playing in the snow and the cold.
Since we're doing invites, I'd like to invite everybody to come out to the MLK. We have a whole week with collaborations with the University of Iowa and other people in the community, and it's just a whole week of festivities starting this Thursday, the 17th, at the Kingdom Center, the Dream Center, with the voter registration, trying to get people out. Friday night is free skating at the Downtown Rec Center. Saturday will be a forum for students. Sunday will be at the Voxman? The Voxman. Yeah, Voxman. We're going to have a gospel show, asking you to please come out, 5 p.m. Going to be awesome. Praise and worship. And then Monday morning, we will open up with the Unity March at 9 o'clock at UAY, starting at UAY, and we'll have a rally for probably about 15, 20 minutes, and then we'll march around to Mercer. And inside, once we get to Mercer, there'll be various activities, and there's going to be some awards and entertainment inside. And food will be served at lunch. 2:30, I cannot leave this out, Bethel AME will have their Black History program, and then at 5 o'clock, the Coralville Library, there will be a reading of MLK. And then on Tuesday, I'd just like to invite people out. If you haven't not seen it, I sent out a private invitation of sending out a semi-formal where you're able to put on some clothes and dress up and come to a fundraiser that I'm doing. The fundraiser is to help us take another 40 students on the Civil Rights Tour. Food is free. So it's a free event. You get to dress up and eat. So come out. That's Tuesday at Settlebrook Clubhouse, 6 p.m. And it's inside, off of Hines Road, inside of,
Clubhouse?
Yeah, the clubhouse. Thank you.
Thank you. Any other comments from anybody else? Okay, next meeting date and time. Who's going to be drafted or volunteered?
I was volunteering Louise.
Been there for a while.
Here in University Heights. I was counting, there's almost 20 people here, and that's, could probably do it. Okay, I'm fine.
Thank you, Louise.
I had talked to her earlier, just so you
I'll
know.
probably have to do that job, too.
It's been a while since we've been there, that's what I
Yeah, it has been a while.
Oh, it was another
Date?
group. Okay, so
My-
it's at the community center, the chambers behind the police station that you see on Melrose and Sunset. That's where it is, where One University Place is, where Maggie's Pizza and the new coffee shop in the back parking lot.
My calendar says it'd be
April 13th.
April 13th,
Is that right?
second Monday of 3 months from now.
Very good. Thank you for being volunteered.
You were glad to see me.
Yeah, Paige now.
Anything else by the group? Time for public comment for anyone who would like to come up and say their piece. Going, we're adjourned.
Okay, great.
I thought you were going to go 3 times, you know.